current PT school students are terrible at understanding this. So let's talk about the reel that I posted last week or the week before about balance, and how when patients come in for balance, they don't have balance issues unless we're talking about some kind of inner ear thing. So if we talk about people that are falling down, going down the stairs, their legs give out, they stub their toe and should be able to catch themselves, but they can't catch themselves, they're just standing and falling down. These aren't issues with balance. So the root cause of this problem is not balance. And working on balance activities with them is not going to do anything. So a lot of the time when I have patients come in that are older, that are Medicare patients, that are coming in for, let's say, low back pain, knee pain, plantar fasciitis, something like that, they tell me that they've been to physical therapy before because they had balance problems. And I'll tell them, so what did physical therapy do with you? Well, they had me stand on that board that wobbles back and forth. Do you really think that standing on a wobble board is going to solve the root cause of somebody's balance issues? The answer to that is no. Okay? So when these people are coming to me, they still have the same balance problems that they had before, but because they're standing on a wobble board at home, or because they stand on one foot with their hands on the table to practice their balance at home, now their balance problems are better, but they have this knee problem, low back problem, hip problem, foot problem. The problem is they have the foot problem, knee problem, low back problem, foot whatever problem, along with the balance issues that it's causing. And they went to see the PT for a balance because some PTs specialize in balance. Now, I know this sounds crazy, but people actually have balance problems and go stand on a wobble board with somebody who's a balance specialist, which is absolutely asinine. So they're coming to you because they have neuromuscular dysfunction that's leading to weakness and instability, because what do we know about muscle? Muscle's job, the purpose of muscle, is to move and stabilize joints. So if muscle is dysfunctional and it cannot normally move and adequately stabilize joints, then that manifests eventually as a balance problem, because now the muscles aren't doing what they're supposed to be doing. You have 6 or 7 muscles that aren't doing what they're doing, which turns into 8 or 9 muscles, which turns into 10 or 11 muscles, which turns into balance problems. So this is not a balance problem at the root cause. So when people come to see us, we need to understand that we are supposed to be specialists and experts in neuromuscular physiology, in movement, in exercise prescription, at getting to the root cause, not giving them some kind of a garbage label like, you have balance problems, so let's just stand on a wobble board. So let's take that thinking apart. Let me see. You have poor balance, so let's make you stand on something that's unstable, and that will fix your balance problem. What? That's the same screwed up logic that people use when they say, well, you have a knee problem, you have knee pain when you squat, so what we do is we squat more. Oh, that hurts more? Well, let's just not squat through a full range of motion. Whenever you get to the motion that hurts, just stop squatting there and come back up. Or it hurts squatting your body weight, so let's unload your body weight and do squats with less body weight. Did we really assess the root cause of the problem? Or did we just turn into a high school kid who could be a personal trainer at Planet Fitness and just regress things until they don't have pain anymore? So the problem with a lot of these PT school students and a lot of PTs that are out there is that they think that's what we do. We give people exercise that fixes their problems, and if they have balance problems, we have them do balance exercises that fix their problems. If it was that easy, people who exercise would never get hurt. And if they did get hurt, they would never have to see a physical therapist, because all they would have to do is jump online and say, what's the best exercise for balance? What's the best exercise for knee pain? What's the best exercise for plantar fasciitis? Oh, they already do that. Why do they do that? Because we have physical therapists that think that giving people exercise is what you went to 7 years of school for, which is not true. So if you are pinning all of your hopes of helping patients on exercises, you are going to fail. I guarantee it, 100%, guaranteed, right here, write it down, guaranteed fail. Because giving them exercise for whatever their problem is, balance, plantar fasciitis, knee pain, low back pain, whatever, is not going to solve their problem. It's going to dance around their problem and teach them how to regress things and avoid doing things and then do more things that actually make their problem worse. So if somebody's got 7 muscles that are inhibited and you make them do more exercise that's supposed to be targeting those muscles, it's going to be further inhibited. The muscles that they're compensating for will now be inhibited, and then they'll get more muscles to be inhibited. So if you're wondering why patients have more pain after exercise, why they have more pain after they go to the gym, even though going to the gym should solve their problem because they're doing exercise, why they have more pain is because you're making them try to facilitate and recruit and use muscles that aren't working. So the only way they can do that exercise is to compensate further with other muscles that should not be doing that motion or should not be doing that movement. So remember, muscle is a contractile tissue that either contracts more or contracts less. It does not relax unless it's dysfunctional. The purpose of muscle is to move and or stabilize joints. You, as a medical professional, are supposed to understand the neuromuscular physiology that goes on behind the scenes to make those gross things happen. You should be analytical in your thinking enough to get to the root cause over here, rather than just giving them balance and exercise over here, which just brought you from a doctoral level, 7 years of college, 6 figures of student debt, down to the level of a high school kid who works part-time as a personal trainer at Planet Fitness. Why would you do that to yourself? Why would you get on people's posts and say all you have to do is exercise and all you have to do to increase balance is do more balance activity? Do you really think if they can't balance to begin with, making them work on more balance is going to fix the problem? If it did, physical therapy could be wiped out in one fell swoop right now. Every outpatient orthopedic physical therapy clinic should close and just put a picture of exercises on their front door and say, sorry, we wasted your time for all these years doing physical therapy. All you need to do is these exercises. Oh, and if it hurts, just decrease the weight or decrease the range of motion and then keep on doing it. Oh, and then if it still hurts, put a bag of ice on it or some heat on it or rub it or do a Theragun or put a piece of tape on it or stick a needle in it or put a cup on it. You can do all that stuff without a license too. So here's the point of this little mini rant. You are a medical professional that went to school for 7 years to learn very important things. If you're not using those very important things as part of your thought process with your evaluation and your treatment program, notice I didn't say diagnosis because you should stop diagnosing people because that just takes you down the road of symptom modification. You should be looking at people from an analytical point of view. What's the root cause? How is this manifesting in their biomechanics and their function? How do I get that function to get better by getting to the root cause over here? And that has nothing to do with giving them a label of some kind of diagnosis, which then is going to make me look in my book of treatment protocols and say, oh, plantar fasciitis, we give you these 4 stretches, the 3 exercises, don't run, don't do this, don't do that, put ice on it, sleep in a boot. Doesn't make any sense. All right. So you went to school to be an expert. You went to school to learn the important things. You learn the important things. The important things is neuromuscular physiology, is biomechanics, is anatomy, is problem solving. Unfortunately, you didn't learn problem solving. You just learned how to fall into a treatment protocol. If you don't know how to do those things and you feel like you're giving people exercise and you know it's wrong, or you feel like it's right, but now you're scratching your head saying, well, I think I'm doing what's right, but it's not really helping, then it's time to join the shift. Post your comments and questions below. I'll see you guys soon.